What really happens to your body when you quit caffeine? If your main motivation for getting out of bed is a steaming cup of coffee, we're with you. In fact, 85% of Americans drink at least one caffeinated beverage every day, per January 2014 research in Food and Chemical Toxicology. But just how healthy is caffeine? And is all caffeine created equal? Not exactly. Caffeine has been shown to provide some amazing health benefits, such as prevention of Alzheimer's and heart disease, but the source of the caffeine is critical, says Annamaria Lulaudis, RD, a registered dietitian at the virtual private practice Culina Health. Coffee contains caffeine along with antioxidants and other active substances that may reduce inflammation and help prevent chronic disease. Soda, on the other hand, contains caffeine but it also delivers added sugars that outweigh the benefits of the caffeine. Read on to learn what really happens to your body when you break up with the stimulant. Who might benefit from going caffeine-free? Not everyone needs to quit caffeine, but there's no doubt some people may feel better living a less caffeinated life. Caffeine may cause an increase in blood pressure, so people with hypertension should consider limiting their caffeine intake, Lulaudis says. For those with gastroesophageal reflux disease, GERD, caffeine may trigger symptoms because it relaxes the lower esophageal sphincter, causing the reflux of stomach acid into the esophagus. That's why coffee, tea and soda, all caffeinated beverages, have been associated with an increased risk of GERD symptoms. Anyone with sleep struggles or anxiety may also benefit from minimizing their caffeine intake. Caffeine consumption within 6 hours of bedtime has been associated with disruptive effects on sleep and increased insomnia, Lulaudis says. You may have caffeine withdrawal symptoms if you've ever skipped your usual cup of coffee and felt foggy. You're already familiar with this phenomenon. Coffee stimulates the central nervous system, so its sudden disappearance can send the mind and body into a frenzy. In fact, caffeine withdrawal can be so severe that the 5th edition of Diagnostic and Statistical Manual of Mental Disorders, DSM-5, even included it as a diagnosis, per September 2014 research in Current Addiction Reports. The primary signs and symptoms of caffeine withdrawal: headaches, intense fatigue, low mood and irritability, trouble focusing, flu-like symptoms. Not surprisingly, the more caffeine you're accustomed to drinking, the more severe your withdrawal symptoms are likely to be, per the Cleveland Clinic. Symptoms can show up anywhere from 12 to 24 hours after you last drank caffeine and may last up to 9 days. You could lose weight if your daily caffeine fix looks like a liter of Coke or a venti peppermint mocha. You'll probably shed a few pounds if you cut caffeine from your diet.